So the definition is a persistent pattern, which means the pattern is seen on a daily basis of inattention and hyperactivity or impulsivity that interferes with functioning or development. So these are behaviors that you see every day. Either the person appears not to be listening, not paying attention, not following through with instructions, doing part of a task, but not the whole task, unable to sit still in their seat. They run from one thing to another. They're the Energizer bunny. They talk a lot. And you can have predominantly inattention, which is they're not paying attention, they're losing details, or predominantly hyperactivity, where they're moving all the time. They usually have characteristics of both, but one may be more evident than the other. The important thing to remember is that in our society, we label these kids as bad kids, as disrespectful kids, and they're not. And I think, unfortunately, kids get boxed into labels, and then it gets really difficult because we're not looking for solutions. So always remember that kids at their basis are really good people. And when they're not performing to an appropriate expectation, it's usually because they can't for some reason, not because they don't want to. And we need to figure out what that can't is and try to give them the skills. And with autism, the recap would be that they're really having trouble with communication with people, making eye contact, sustaining a conversation, playing side by side. Skills can be improved with the right kind of therapy and interventions. It's really a spectrum where we go from one end to the other, and people have all kinds of functionings in between. Is that a good recap?
That was excellent, Connie. Thank you so much. The first time and the second time, it really is great information for our parents, for our caregivers, for the community. You did a fantastic job explaining a very difficult subject in terms that I think everybody can understand. So thank you so much, and thank you for the Wheeler Clinic for doing that.
Our pleasure.
It's fantastic. And so before I turn it back to Ms. Claudette Graham, who is our educator, director of education for the West Indian Social Club, I will, the question for the $25 gift certificate, and it's gonna be hard. Well, probably not. So, the first person who can get the answer in the chat, what is the name of the other unrecognized, undiagnosed disorder, I'll say that, that Connie talked about, and it has like 4 words in it. And it's not one of the topics, right? So it's not ADHD and it's not autism, but she said there's something else that typically needs a neuropsych testing, needs a referral, and encourages families, caregivers to look it up so they go into the pediatrician's office armed with the information. Is it too hard? Nobody's answering.
That's kind of hard.
Oh, it's kind of hard. Okay, so, well, I guess it goes to...
oh, well, there's a good one.
Can I play?
We'll give it to Nadine. Something learning disorder. Non-verbal was what came before it.
Okay, I couldn't remember that part.
Good job.
Good job, thank you. Okay, so Nadine gets the gift card. Thank you, Nadine, for playing. Miss Graham, I'll turn it back over to you for closing.
Thank you, thank you. I think there was another question in the chat. Dr. Wu, can you see the chat? There was another question.
I did, I'm sorry, yes. Where does disruptive mood dysregulation disorder fit into this area? Is that the question?
Yeah. So DMDD, DMDD, disruptive mood dysregulation disorder. We use it for kids who have outbursts that are really uncontrolled, and they're pretty significant outbursts. It could be a prelude to bipolar disorder, but not necessarily. Is that enough of an answer?
Yes, thank you. I was just trying to figure out if some of the symptoms of autism are also a part of that, or if that would be completely different.
It's completely different.
Okay. Okay, thank you.
You're welcome. Although you will see disruptive behavior in kids with autism. But usually it's because we haven't met their need and they're frustrated and they can't communicate what they want. And so I find a lot of times if we let behavior go on for a while, so sometimes we have kids who are difficult. So their ADHD isn't treated. And they're really frustrating because we think they're not doing what we want them to do, when in reality, it's that they can't do it. But some of that is also setting limits. And I have parents who are so stressed in so many parts of their lives that sometimes it's easier to give in to the child than it is to set the limit. And what that teaches the child is that the more I scream, the more likely I'm going to get what I want. And so as time goes on and that doesn't resolve, you can end up with temper tantrums that are really horrific. That's not to say that's where DMDD comes from, but it's part of explosive behavior that doesn't really have a basis in mental health, but has a basis in skills for raising children.
Thank you.
Okay, are there any more questions? You can just unmute yourself and ask. We have a few more minutes. Well, we have 1 minute. No more questions? Then I'll just go ahead and wrap it up. We want to thank Dr. Wu for his excellent job in moderating the program tonight. We'd also like to thank Chev, our program coordinator, And our chairperson of the West Indian Social Club is Beverly Red, who pretty much put this program together. However, a big thank you will have to go to Concepcion Cortez Connie, APRN psychiatric nurse provider, for that wonderful job that you did in presenting tonight. You broke down the concepts of ADHD and autism and made it simple, relatable, and enlightening. Thank you. Thank you for an informative presentation. Congratulations to Nadine. I'll reach out to you to give you your gift card. If you or someone that you know can benefit from this mental health series that's operating in the collaborative effort with West Indian Social Club and Wheeler Clinic, please reach out to us or to Wheeler Clinic. The information is in the chat. These discussions really are meant to help the community. Our goal in providing these programs is to bring help to the community. We can assist you by informing you and guiding you to the right professional resources. Mental health is and will always, it seems, be a stigma in our community, and it prevents us and presents a barrier for us in getting help that we really need. And we really need to change that mindset. So please reach out if you need help or if you know someone who needs help. That's why we put on these programs. We bring it to you. They said if the mountain will go to Mohammed, Mohammed will go to mountain, or something to that effect. Please join us next month on the last Thursday, August 25th, where our topic will be marijuana, cannabis, the use to self-medicate, the effect on mental health, the role of caregivers and their self-care, well-being, self-neglect. That will be next month, August 25th, 7 p.m. Same Zoom information, and that will be presented by a Wheeler Clinic clinician. Thank you, ladies and gentlemen, for joining us, making this program another success, and we wish you a great night. Thank you. Thank you again, Connie. You did a great job.
Thank you, Connie.
Thank you, everyone. You were great. Thanks.
Thank you.
Good night.
Bye.